Well, hello everyone. Welcome to the All Things Celiac webinar series brought to you by the National Celiac Association and the Harvard Medical School Celiac Education and Research Program. Today's topic is navigating the gluten-free diet, insights and guidance to address medical, nutrition, and social aspects in the adult and pediatric celiac population. My name is Chris Rich, and I am the CEO and Executive Director of the National Celiac Association. We at NCA provide educational resources to our celiac community, such as this All Things Celiac webinar series, and we value the opportunity to continue this work in collaboration with the Harvard Medical School Celiac Education and Research Program. In addition to our educational programs, the National Celiac Association offers an extensive support network that reaches from coast to coast and assists everyone from kids and their families through our Raising Our Celiac Kids or ROC program to our focus on older generations through our Support Our Celiac Seniors initiative. You can find more information about the ways that we act as the voice of our community on our website at nationalceliac.org. The highly collaborative Harvard Medical School Celiac Education and Research Program was founded in 2013 and has a twofold mission of developing and promoting the latest research in celiac disease and advancing awareness about celiac disease through educational programs to clinicians and the general public. Education is at the heart of the HMS Celiac Education and Research Program, and these webinars continue to feature multidisciplinary speakers with specialized knowledge on celiac disease, related autoimmune conditions, and nutrition. Today's session is being recorded and will be available for viewing on the National Celiac Association's website at nationalceliac.org. You can select the Resources tab from the drop-down header and click on NCA Webinars. The recording of today's session will appear there in approximately 5 to 7 business days. Our moderator and one of our guest speakers for today is Dr. Amelie Therrien. Dr. Therrien received her MD in 2011 from Université de Montréal and completed her internal medicine residency and then her adult GI fellowship combined with a clinician scientist program in 2017. She also has a master's in science and experimental medicine, working on granulocytes and innate immunity. Her main areas of expertise are celiac disease, other small bowel disorders, and nutrition. She completed a fellowship at the Celiac Center at Beth Israel Deaconess Medical Center and is now working as a clinician scientist there, working on celiac disease and mast cell-related disorders. It's always a pleasure to work with her, so hello and welcome to Dr. Therrien.
Thank you, Chris, and thank you, NCA, for hosting this webinar. We are having a topic today that is more like day-to-day life, navigating the gluten-free diet, insight about how to address the medical part, nutrition, and social aspect in the adult and pediatric celiac populations. And there is a Q&A section where we invite you to submit any questions you would like to have for the speakers. We won't, unfortunately, have the time to address all of the questions, but we will make sure to have a broad variety of questions answered. There would be CEUs available for registered dietitians, nurse, physician, and social worker who attend this webinar. There is a link in the chat that should allow you to register to have those CEUs, and Dennis is coordinating that with you through the chat. And we'll now go for our first speaker, who is from Boston, from our colleagues at MassGeneral. So Katarina Mollo is a clinical dietitian at the Center for Celiac Research and Treatment at Massachusetts General Hospital for Children. She specializes in celiac disease. She uses her education and expertise to help patients with celiac disease and other gluten-related disorders to navigate the gluten-free diet, and is devoted to educational programs for increasing awareness of celiac disease and other gluten-related conditions. Katarina was diagnosed with celiac disease as a young child, so she has lived experience of navigating everyday life gluten-free. Katarina has worked in the field of nutrition and celiac disease since 2008 and is the past director of education for the National Celiac Association. She holds a Bachelor of Science in Food and Nutrition and a Master of Education in Nutrition Education from Framingham State University. So thank you, Katarina, for being part of the webinar.
Thank you so much, Amelie. Thank you for having me today. I'm so happy to be joining you this afternoon. I'm going to be addressing two very important topics, vital to managing the gluten-free diet, food labeling, and cross-contact. All right. All right, so here is kind of a brief overview of what I'll be talking about today. I'll be discussing a lot of different things. So labeling, I'll start off with how to read the label, gluten-free labeling, FDA food allergen labeling, allergen advisory statements, medications and labeling, and then we'll switch gears a bit and talk about cross-contact and gluten. So we'll be focusing on cleaning, how to clean away gluten and how to safely share a kitchen. And then later on, Mariah will talk more about cross-contact and restaurants. All right, so let's start off with food labeling. So knowing how to read a food label really is one of the most important steps in managing the gluten-free diet. It is the fastest way of finding out if a product contains gluten or not. And always check the label on anything that you're eating or drinking. And this also includes things like supplements and medications. And also keep in mind that ingredients, they frequently change. So make sure you check each time you have the food. And if you're newly diagnosed, this might seem really overwhelming, to always have to be checking labels. But really, it will become second nature to you really quickly to be checking labels. You won't be noticing that you're even doing it. And always, contact the manufacturer directly if you are unsure about a product or ingredients. All right, so here's just kind of like a really quick overview how to read the label. I usually divide it into 3 steps. First, you see, does this product have a gluten-free label? This may or may not be listed. And then the second step, you look for allergen statements. And you also look at the ingredient listing. So wheat must be declared as an allergen if it's present in any food regulated by the FDA. And I will discuss this more in detail later on. And always read through the ingredient listing very carefully. And for products not labeled gluten-free, there are 6 things to look for. And I mentioned wheat already. So you're looking for wheat, rye, barley, malt, brewer's yeast, and oats. So these 6 things will always have gluten in them if something is not labeled gluten-free. All right. You always want to make sure oats, because they have high risk of cross-contamination with gluten, make sure anything with oats or has oats in it, make sure that's always labeled gluten-free. And you always want to make sure grains and flour should always also be labeled gluten-free due to high risk of cross-contamination, with the exception of rice. And here is just kind of like a little overview of the process. And this is from our label reading guide at MGH, which you can go to the MGH website and look at if you want more information about how to read the label. All right, so what is considered gluten-free? So the FDA considers a food to be gluten-free if it contains less than 20 parts per million of gluten. And it's important to remember that this is a concentration, not an amount, but it's a very, very small concentration. So 0.002% would be equal to 20 parts per million. And this is considered a safe concentration for somebody with celiac disease. And what about gluten-free labeling? So gluten-free labeling is voluntary. So food manufacturers, they're actually not required to indicate if a product is gluten-free or not. But if they do indicate that it is gluten-free, they do have to, that does include cross-contact. It has to contain less than 20 parts per million of gluten. And that's including ingredients and cross-contact. And the FDA, they actually don't require a specific gluten-free label. So it might vary from product per product how the gluten-free labeling looks. And sometimes it's really tiny too, so you kind of have to look around on the product to see where it is. All right, and these following claims must comply with the gluten-free labeling rule. So if it says no gluten, free of gluten, without gluten, those have to follow that gluten-free labeling rule and have to be less than 20 parts per million of gluten. However, if it says made with no gluten containing ingredients or made with gluten containing, or not made with gluten containing ingredients, it does not have to comply with the gluten-free labeling rule. So how about gluten-free certification? So some manufacturers, they will choose to certify their foods products gluten-free, and this is different from the gluten-free labeling. So this means that they have to follow the rules and protocols of a certifying organization in addition to the FDA. So there are several different certifying organizations on the market. So they're all third-party private organizations. They're not governmental organizations. And they all vary in their requirements, but they do have to at least follow the FDA regulation of containing less than 20 parts per million of gluten. And many of them do have lower thresholds as well. And they may or may not include more testing protocols. And I frequently get asked by patients, should I only get gluten-free certified foods? But it really is not necessary to buy all, certified gluten-free foods. As I mentioned, anything labeled gluten-free must contain less than 20 parts per million of gluten. And this is considered safe for somebody with celiac disease. So let's talk about allergens on the label. So the FDA's Food Allergen Labeling and Consumer Protection Act, or FALCPA, that's a law that requires food manufacturers to disclose the top allergens, which are wheat, milk, eggs, soy, fish, shellfish, peanuts, tree nuts, and sesame also was later added to this list. And it's important to note here that barley and rye are not listed as major allergens, only wheat. So gluten does not have to be listed as an allergen, only wheat. And wheat-free does not necessarily mean gluten-free. So you still have to watch out, for barley and rye. So always go into the ingredient listing and read ingredients carefully. And wheat will be declared in one of two ways. On the label, either in parentheses, following the ingredients within the ingredient listing, or it will be in a statement following right after the ingredient listing, usually in bold letters, as you see here, contains wheat. And FALCPA applies to foods, beverages, and dietary supplements. It does not require any information regarding cross-contact of foods. It doesn't apply to foods regulated by USDA or alcohol beverages that are regulated by TTB, prescription and non-prescription drugs, pet foods, and cosmetics. And as mentioned previously, barley and rye does not have to be disclosed as allergens on the label per FDA. Rye would not typically be a hidden ingredient, so that would just be listed as rye. But barley, you may see one of the following words: malt, malt extract, malt vinegar, malt syrup, malt flavoring, or brewer's yeast. These are not safe and contain gluten. And also, rarely, yeast extract, autolyzed yeast extract, brown rice syrup, smoke flavor, and natural flavoring may contain barley, but it is pretty rare. But always check with the manufacturer if a product has any of those ingredients, unless the product is labeled gluten-free. And what about USDA labeling? So products regulated by the FDA that covers meat, so beef, lamb, and pork and poultry, eggs, and egg products, and processed foods that contain more than 3% raw meat or 2% cooked meat or poultry. And the USDA requirements are, all ingredients they are required to be listed by their common name, and USDA are not subject to FALCPA, the top allergens, but they are, encouraged to have allergen statements on the label. And many also produce products for FDA. So it's estimated actually that about 80 to 90% of USDA manufacturers, they also actually follow FALCPA and will declare wheat on the label. And for products that are labeled gluten-free, USDA does follow the FDA's gluten-free labeling rule. And what about the allergen advisory statements? So I'm sure you've all seen these statements, such as, made in the same facility with wheat, or made on the same equipment, or may contain wheat. So these statements, they really cause a lot of questions among consumers. And this is the most questions I actually receive from patients in clinic about these statements. First of all, these statements are voluntary. They're not regulated. They're not the same as the allergen statements under FOLCPA. And they refer to processing procedures, not ingredients. So manufacturers, they do still need to follow good manufacturing practices. They still have to clean and things in between making foods. And for foods labeled gluten-free that has one of these statements, they must contain less than 20 ppm gluten, and that's including cross-contact. Right? So if a product has a gluten-free label and has one of these statements, they will still have to follow the gluten-free labeling rule. So what about foods that are not labeled gluten-free? So products that have these statements, they should be okay if, make sure there's no gluten ingredients listed and it's not a grain-based product, because remember, grain-based products, they do have to be labeled gluten-free. But if you are unsure, always contact the manufacturer about, their cleaning protocols. Ask them about if they have cleaning protocols in place, which they are required to have. And gluten is easily cleaned off of most items with cleaning. So if a product is not labeled gluten-free, it should be okay as long as it doesn't have gluten ingredients, but always, make sure if you are concerned. And what does the research actually say about these statements? So the research actually shows that these statements don't necessarily correlate with gluten content. So 9% of products that did have one of these statements, they did contain quantifiable gluten. And 14% of those that did not have one of these statements contained quantifiable gluten. So these statements, as you can see, they really are not very meaningful to determine actual gluten contamination. And to make things more confusing, some wheat-derived ingredients are actually safe on the gluten-free diet, and the following are safe even if they're derived from wheat because their gluten is removed in the processing. So citric acid, dextrose, distilled alcohols, distilled vinegar, glucose syrup, maltodextrin, those are all safe on the gluten-free diet, even when they're derived from wheat. And National Celiac Association, they do have a really good page about confusing ingredients where you can read about different ingredients and why or not they're considered gluten-free. So you may have seen some labeled gluten-free products using wheat starch as an ingredient. And wheat starch that has been specifically processed and tested to contain less than 20 parts per million of gluten is allowed to be used as an ingredient in gluten-free products that fall under FDA. If they're labeled gluten-free and has this specific wheat starch in it, they are required to carry the following statement: the wheat has been processed to allow this food to meet the FDA's requirement for gluten-free foods. But always make sure, if something has wheat starch in it, that it does have this statement and is labeled gluten-free, because regular wheat starch is not safe on the gluten-free diet. What about oats? So most commercially available oats in the US have had significant cross-contact with gluten-containing grains, and this happens through crop rotation, harvesting, processing, and transportation. And gluten-free oats are considered safe for most people with celiac disease. However, a small subset of patients do actually react even to gluten-free oats. They react to the protein in oats. So always check with your healthcare provider before introducing oats and if this is okay for you. And you may have heard of different protocols to keep oats gluten-free, such as purity protocol, versus mechanical sorting or optically sorted gluten-free oats. So the bottom line here, oats really need to test below 20 parts per million, regardless of what protocols they're using. So always make sure any oats or anything containing oats are labeled gluten-free, and ask your dietitian or doctor for recommendations on safe sources of oats. So I'm not allowed to mention brands in this presentation. So reach out to your healthcare provider for that. And as mentioned previously, always select grains and flour-based products that are labeled gluten-free. And this is because grains have a really high risk of cross-contact with gluten. So a study of naturally gluten-free grains that were not labeled gluten-free, they found that 32% of the samples contain more than 20 parts per million of gluten. So, and also never buy grains or flour from bulk bins because they have a high risk of contamination as well. Always buy pre-packaged gluten-free labeled grains. And just a quick note about legumes, like lentils can contain a certain amount of foreign grain by weight. So again here, do not buy beans or lentils from bulk bins as they might have cross-contact with gluten. And when it comes to lentils, buy packaged lentils labeled gluten-free. And for canned lentils, make sure you clean them, but pour them in a colander and rinse. And dry lentils, we recommend pouring on the cookie sheet and pick through to remove any foreign material and rinse in a colander. And how about medications? So gluten is rarely used in medications. However, they may be used as a binder or filler, but you always check medications, both over-the-counter and prescription, for ingredients. And the rules of labeling for medications are different from that of foods. So fillers can be derived from wheat, but not declared. So FALCBA does not apply here. And you want to look for like starches and pre-gelatinized starch that may be from wheat. And barley and rye are not typically used in medications. And you can research, medications by, checking the insert of your medication and check the inactive ingredients. Also inform your prescriber and pharmacist of the gluten-free requirements. Sometimes they can check it for you. Also, you can contact a pharmaceutical company for ingredients and always ask them what the ingredients are rather than asking, is it gluten-free? Because if they're not testing for gluten, they will not tell you if it's gluten-free or not, but ask them for the ingredients. And there's a really great site called Daily Med where you can look up medications. It's a government site where pharmaceutical companies, they do have to report the ingredients of their medications. So check that one out. And in the rare circumstance that you may not be able to get a gluten-free medication, then you can use a compounding pharmacist. All right, so now we'll be moving into cross-contact. All right, so what is cross-contact? So cross-contact with gluten happens when gluten-free foods come in contact with gluten-containing foods. So it's really important to avoid cross-contact when prepping foods. And again, I will only address cross-contact in the concept of, sharing kitchen, and later Mariah, she will talk about cross-contact in restaurants and eating away from home. And one of the most common questions I get from patients are, can I have a shared kitchen, or do I make the whole house gluten-free? So you can totally have a shared kitchen when you have celiac disease or on a gluten-free diet, but you just have to follow a few simple steps to avoid cross-contact with gluten.
3 minutes, Katarina, 3 minutes, thank you.
All right, so luckily gluten is easily cleaned off most items and surfaces with soap and water. And there's no need to get, new dedicated pots and pans or plates, glasses, cups, and silverware and utensils. All of those are, easily cleaned by just washing your dishes with soap and water, using a clean brush or sponge, or you can just put them through the dishwasher. And for surfaces, make sure they're free of crumbs, and wipe down counters and dining surfaces with a clean cloth with dish soap and water. And people often ask me about transferring gluten, when they're touching things. So I always tell people, always wash hands with soap and water before eating. That's always a good rule to follow. And so always wash hands before eating or before prepping foods. And some tips when sharing a kitchen: drop-in toasters. We do recommend using a separate dedicated toaster because they are not you can't really clean those. That would be kind of dangerous. Toaster ovens, you can use a shared one. You just make sure the rack or tray is cleaned, or you can use aluminum foil. And for an air fryer, just make sure you clean all food contact parts with, dish soap and water. And use separate, clean serving utensils when you're serving foods. And spreadable condiments, you get a lot of crumb transfer when you use that. So if you're using a knife and you're spreading peanut butter on your toast and then putting it back in the jar, in the end, you're gonna get a ton of crumbs in that jar. So we do recommend having separate spreadable condiments. So for butter and peanut butter, have separate items for that. And you can also use squeeze bottles for like mayo, mustard, and jelly. I haven't seen squeeze bottles for butter and peanut butter. I don't think that would work well. You can also do a no double dipping policy in the household. So that works for some people. I think it's easier to do that when you're everybody's used to the gluten-free diet already. But in the beginning, for people that are newly diagnosed, it might be easier to just have separate and squeeze bottles. And here are just some helpful tips. Store gluten-free products separate or above gluten-containing products. Label or color code gluten-free items. I also frequently use just a marker or Sharpie just to write my name on things. And make meals that you eat together, all gluten-free, then it's just easier to avoid cross-contamination. And if you do make items with gluten at the same time as gluten-free, make the gluten-free item first to avoid cross-contamination. All right, and here's just a quick summary of some knowing how to read the label is crucial when adhering to the gluten-free diet. And reading labels for gluten can be complex, as there are many different ingredients and many different regulations for food labeling. And gluten does not have to be disclosed as an allergen in foods or medications. And avoiding cross-contact is an important part of staying gluten-free. And gluten is easily cleaned off most items with soap and water. And it's okay to have a kitchen when on a gluten-free diet, as long as you prevent cross-contact with gluten. All right, and then I just included some resources so you can check out. NCA has great resources, and we also do on our celiaccenter.org website. All right.
Thank you. Thank you so much, Katarina. That was a
Sorry, I had to be really fast because I had a lot of information.
It's okay. It was a really packed presentation with lots of information. And we'll have questions after. So now I will introduce Mariah. Mariah K. Jackson is a registered dietitian, nutritionist, and an assistant professor of medical nutrition at the University of Nebraska Medical Center in Omaha. She holds a master's of medical nutrition degree and a PhD in patient-oriented research. Diagnosed with celiac disease at 2 years old, she has been active in the celiac community from early on. As a passionate advocate, she led a gluten-free friend support group club at Iowa State University, while also promoting change in the dining halls for safe and equitable gluten-free food choices. Now, as a dietitian, she is a co-leader of an NCA local partner group in Omaha. And professionally, she teaches graduate nutrition students and conducts research on fiber, anti-inflammatory diet patterns, and health outcomes like cognition and the microbiome.
Thank you so much for that introduction. It is so nice to be here with you all today. Let me share my slides with everybody. I'm happy to pick up where Katarina left off and really start to transition out into navigating these social situations, and I'll cover both childhood and adult scenarios. I don't have any big disclosures today. Just a little bit more about me. I'm very passionate about this topic as someone who has lived it, and I'm happy to share my insights and strategies I found helpful that you can take home and apply to your specific situation. I was diagnosed at about 2.5 years old, and it took over half a year for doctors to figure out why I was so sick for so long. I've been that kid who other people didn't know how to feed me, the kid who packed their lunch every day going to school. had to go home because I've been glutened. I've lived it. I've also had amazing times bonding with people who get it. When I went to college, I started a gluten-free friends club, and then we were able to do totally normal college things like go bowling together and decorate holiday cookies, as well as be able to advocate for equitable and safe food options in the dining halls. And now with the NCA, I still love facilitating these social events and promoting this sense of community and fun. This is very important to talk about because food is such a big part of our social life, from birthday parties, school events, dinner with friends, work lunches. For people with celiac disease, these situations can sometimes bring stress instead of joy. The biggest challenge we need to address is safety. Gluten can be hidden in sauces, shared utensils, or even in crumbs, as mentioned earlier, and even a small amount can trigger symptoms. There's also that social challenge where one might feel embarrassed or excluded or even uncomfortable in speaking up about declining food. Today, we're going to focus on some strategies to help both kids and adults navigate these situations safely and gracefully without missing out on the connection and fun. For children, some of the most common scenarios are going to be around school lunches, birthday parties, and sports activities where snacks can be shared. Adults may encounter similar challenges with restaurants, work outings, and large family gatherings. All these types of environments can increase that risk of cross-contact that we talked about earlier and can create social pressure. So this is why living with celiac disease requires having several tools in our toolbox. Knowing the situations that have that ability, that opportunity that where cross-contact can occur with gluten, watching out for those hidden sources of gluten, having our key label reading skills, and being able to plan ahead with clear communication are some of our most handy tools. By putting these tools in our toolbox, we can start to feel more empowered and capable of tackling social situations. For planning ahead revolving around kids, preparation usually means involving the adults around them. These could be their teachers, their coaches, or other parents who need to know. A 504 plan can usually help facilitate these conversations and ensure accommodations within the school setting. The NCA website has some great resources if you want to learn more about 504 plans. Sending a safe snack or a meal can help also reduce the risk of cross-contact and help that child feel included. Sometimes identifying things that to have on hand can save stress when unique situations pop up. Growing up, we always had some cupcakes in the freezer that we could easily defrost if we were invited to an occasion kind of last minute. Also, being able to role play with kids is a great way to foster this ownership and empowerment of living with celiac disease. Teaching them the polite ways to say no thank you and to ask about ingredients can help build their confidence. Even practicing a short phrase can be a helpful tool to reach for in a new situation. For college, we know that college brings new freedom, but also new challenges, especially in shared spaces and communal dining. Dining halls may have gluten-free stations, but always ask about those cross-contact situations. And don't be afraid to speak with the food service manager, or some colleges even have their own dietitian related to the dining halls. Some colleges also require a meal plan for certain people who are living in dorms, so always check that out if a meal plan is required for the place that they're living. Roommates can be a key part of your support system. Having that open and respectful conversation early on, but also being curious about their needs in return can be a way to establish those clear guidelines and have that shared space. Social events like pizza nights or tailgates are also very common during college. Sometimes there are dorm-sponsored events that may be able to make accommodations, but feel free to bring your own safe food or eat beforehand so you can still participate socially in them. Most larger colleges have a club for almost any topic, including food-related interests. They're also pretty open to starting your own club, and that can be a great way to build that camaraderie across campuses. Campuses most often also have a disability service or accommodations office, and registering with them can give you access to those accommodations for dining support, any classes, if advocacy issues arise. I know at my time at Iowa State, I did register with the disability services, and so I've had some protections in place if I had to miss class while I was sick from being glutened. For adults, different types of interactions may direct your plan of action. With acquaintances or formal events, maybe this is a networking dinner or a wedding, you may not have as much opportunity to control the outcome. In these cases, it can help to call the restaurant or venue ahead of time and give a simple explanation of your needs, and consider bringing a backup snack just in case. This is usually a situation where I have a protein bar in my purse, just in case. With close family or friends, you can usually be more open, explain your needs in more detail, help them plan the menu, offer to bring a dish to share, which can provide that sense of connection over a shared meal. I also frequently hear about the challenges with in-laws, which may be a particularly sensitive issue or relationship. Balancing family dynamics while staying safe requires patience, consistency, and sometimes repeating the message several times before it really sinks in. Going to restaurants can be another social situation that is difficult to navigate, but when you have a key set of questions in your toolbox to reach for, it can make this a lot easier. So you can open up the conversation broadly by asking about the menu if they have a gluten-free menu, and then have a couple set of follow-up questions ready, such as about dedicated fryers for things like fries and chips, or if they're shared with things like that are breaded, like onion rings or chicken tenders. For places that do pizza or pasta, make sure that there is a separate area or separate preparation pans or cutters that are used, separate pasta water or pots. When you go to things like sandwich shops that might offer a gluten-free bread option, you can do things like request a glove change, and they usually can put down like a different mat or something to help keep that cross contact at a minimum in that situation. Things like breakfast restaurants, it can be easy to ask about, do you add any flour or batter to your eggs, or do you dust your potatoes with flour to get them crispy? Is the griddle or toaster space shared, or could you do my eggs in a separate pan? So knowing these areas of potential cross contact can help you feel prepared to ask about these areas. You are a potential customer, not a bother. You have the right to politely ask about their practices that impact your health. We know that communication can be one of the most intimidating parts of navigating celiac disease in social settings. It's not just about what you say, but how you say it. And this is why polite refusals are an essential tool to have. For children, sometimes saying something as simple as, gluten makes me sick, may work well. Or adults, maybe a direct explanation of, I have celiac disease, I can't eat gluten. That may just be enough. These phrases, paired with a calm, confident tone, can help set the scene. You are in control of what goes into your body, and by asking with a curious tone, can prime others to respond helpfully. But what about when someone says something a little harmful, like, can't you just have one bite? This can often feel invalidating and pressuring. A graceful response that is factual but firm, but not confrontational, can help guide this scenario. Even just saying, even just a small bite can help make me sick, but thank you for the offer. And then really kind of shift the conversation back to whatever is going on. I'd love to hear more about XYZ. This can help protect your health and maintain that dignity in your relationships. We know navigating social situations are hard. Food is how we celebrate, bond, and connect. And when you live with celiac disease, you can sometimes feel like the odd one out, or like you're inconveniencing others by just protecting your health. But speaking up can be empowering. The first time you say, I have celiac disease, I can't eat gluten, or I can't have that, no thank you, it may feel very uncomfortable. But the second, third, fourth time, it gets easier. And each time you successfully say that, you can help reclaim your ownership of your own health and safety. Support systems can amplify this confidence. For kids, having that parent, sibling, or teacher who understands and backs them up can make that birthday party feel safe instead of scary. For adults, knowing a friend at the table who understands makes it easier to relax and focus on the people, not just the food. As the world is becoming more aware of celiac disease, these conversations are getting a little easier. More restaurants are training their staff, more people have heard about gluten-free diets, and this shift is making it a lot less of a battle and more of a quick, respectful exchange. The result is we start to feel more free in trying new experiences, saying yes to invitations, and focusing on connection rather than avoidance. Again, having that support system makes social life with celiac disease far less stressful. Family and friends who understand your needs, they can then advocate for you and help make safe choices and help you feel included. The key is teaching them why this is important. It's not just a fad or a preference. Explaining that celiac disease is an autoimmune condition and that even tiny amounts of gluten can cause harm helps reframe the conversation for why it's important. While with family, patience goes a long way. It may take those repeated conversations, demonstration of what cross-contact risks are, or even showing them some of our medical resources before it can really click. Reassure them that their efforts are making a difference. Friends often want to help but may not know how, and giving them simple, concrete steps like use clean utensils, avoid double dipping, or even just help letting them bring your own dish can be a helpful step. When you teach in this kind of clear and encouraging way, they're more likely to be able to remember and support you. Over time, having this network of people who get it can build your confidence, and you no longer feel like you're carrying the responsibility alone, and that makes navigating social situations a little less overwhelming. Now, feeling left out can be one of those common challenges for kids in general, or even adults, with having celiac disease. And they may be saying things at like parties or school events and see other kids eating cake or pizza and wonder, why can't I? The first step in helping them is letting them know that they're not alone. Many children live with allergies, diabetes, or other needs that require special care when it comes to food. Everyone has differences. Encouraging kids to be curious and excited about others' differences, knowing that they are part of what makes us unique. We can help reframe this on what we can do, our other interests and strengths, instead of seeing it as just a can't or a weakness. Over time, learning to embrace our differences not only protects their health, but helps them build confidence, resilience, empathy, and self-confidence. Having a couple practice phrases when your child comes to you feeling left out can help heal the situation. Even just acknowledging your friends like you because of who you are, not what's on your plate. You belong, and you are just as much a part of the fun as everyone else. Or even acknowledging that again of, I know this feels hard when you can't eat what everyone else is having, but your food is what keeps you strong and healthy. It's like, insert reference here. You know, what's Superman avoiding kryptonite so he can be strong and save the world? Or, you know, what's relevant to your kid? But just by acknowledging their feelings and help shifting it back to what things we can do and what we appreciate about each other can help us reframe this and help empower them. So I wanted to share some resources. Again, the National Celiac Association has some great resources for both kids and teens, as well as college and restaurants. We've also had some great past webinars in this series on the 504 plans and then navigating like holiday scenarios. I also wanted to note that there are several apps out there on the market that can help find restaurants or safe food in stores. These are not the be-all, end-all, and not are always up to date, but they can start to point you in the right direction and help narrow down some options if you're looking for specific restaurants or tools. It is important to have several tools in our toolbox, so having, when you come across a new situation, you have the right one to pull out. I wanted to end today with a personal situation to help demonstrate these concepts. When I was about 12 years old, I had a sports tournament day and we had a free hour for lunch. There was a restaurant within the sports complex, and at that point, I was fairly well versed in my practice phrases and the questions I needed to ask about food. I had a go-to phrase of, I can't eat wheat, oats, barley, malt, or rye. I saw on the menu that they had tacos, and I felt empowered to ask my server, are your tortillas made with wheat? She said no, and so I ordered them. The tacos came out, and the tortillas didn't really look like the corn tortillas I was used to, but I trusted the situation. But unfortunately, there was a gap between the two of us in communication and knowledge. I then tasted them, and they didn't really taste like corn tortillas, which was finally enough to push to ask about it again. In response, the server said, oh, they aren't wheat tortillas, they're flour tortillas. So I got very sick and went home. I shared this example for several reasons. One, you can plan ahead and have your tools ready to go, and things can still go wrong. This reminds us that perfection isn't the goal. Safety is about doing our best and not blaming ourselves when something slips through. Two, it did teach me the hard way a little bit to clearly communicate and to probe for knowledge gaps in the future. I needed to ask follow-up questions and not just accept the first answer. That's a skill that kids and adults can practice in all kinds of settings. And lastly, I didn't let this experience hold me back, but strengthen my resolve to advocate for my own needs. These are learned skills that take practice. What matters is not avoiding every mistake, but learning, adapting, and continuing to live life fully and joyfully. So this makes our key takeaways for our toolbox today are planning ahead is the best way to help stay safe and avoid stress. Communicating clearly builds confidence and helps others understand. Having that support system matters and makes social situations easier. Differences are not setbacks, they're a part of what makes us strong. And social life is about people and connection, not just food. With preparation, confidence, and support, living gluten-free doesn't mean missing out, but it means showing up fully, safely, and joyfully. And with that, I will hand the floor back over to everybody else. Thank you so much for listening.
Well, Mariah, thank you so much for presenting for us today and also for being a larger part of the National Celiac Association community. We do appreciate that. So I am going to hand it back over now to Dr. Amelie Therrien, and she has already shared her slides, so I will just hand off the floor.
Thank you. So I will briefly talk about gluten exposures, what happened in the body and what we can do when it happened, in addition to how much cross-contamination could not be a problem with celiac disease, but it's a big gray area. One of the disclosures is that we will discuss medications that are not approved by the FDA for celiac disease. And regarding medications, it has been like a huge topic in the chat about how like there is no regulation in the US for the gluten labeling in medications. Since 2018 and way before, there was the Gluten in Medication Act that is kind of like somewhere with the House, but unfortunately has not moved. But there has been some advocacy initiative with the Congress to try to improve labeling and disclosure for medications and have gluten-free medication. So going back to my initial topic, so the immune system will always remember the gluten, even if you are on a gluten-free diet for a long time. So yes, having celiac disease, following a gluten-free diet will lead to improvement of your symptoms that were due to gluten, inflammation of the GI tract. There will be eventually improvement of your small intestine and progressive decrease of the antibodies that we check in your blood, such as the TTG. However, you will always still have some immune cells in your small bowel that are called gluten-specific T cells that will recognize the gluten. And so once it has been activated, once you have developed celiac disease, your body will remember what is gluten. There are several studies now looking at punctual symptoms while following a gluten-free diet, either in real life or when it's a gluten challenge for research. I really like this one from my colleague Justin Silverster. So they asked patients with celiac disease 6 months after their diagnosis whether they had gluten exposures. The majority said yes, and 2/3 of them were symptomatic. The symptoms started about an hour after the ingestion of gluten and lasted about 24 hours. Compared to symptoms they had at the time of their diagnosis, the frequency of abdominal pain and vomiting were a little bit more common. And when asked about what amount of gluten they had, 51% had symptoms with much less gluten than what they were having before their diagnosis. Some did not report symptoms every time gluten was consumed. And 36% of them were kind of like unsure how much gluten. They kind of like had a reaction, but they were unsure what was the source of the gluten that caused the reaction. So there's a wide variability among people's reactions. This is from a study where for a drug trial, people were drinking a shake with 10 grams of wheat flour, which is about 4 slices of bread. So the red boxes mean significant symptoms and the blue one means not really symptomatic. So overall, many of them had nausea, vomiting, tiredness, headache, bloating, and it started within 2 hours of the ingestion of gluten. But there were also people with celiac disease who didn't have much symptoms after consuming this amount of gluten. We think that this may be due to cytokines. So cytokines are like little arrows that are released by the immune cells. So when someone with celiac disease has gluten, there are those cytokines that get released in the blood, in the small intestine, and it has various roles in inflammation. But looking at the study results again on the right, some people had more cytokines, the red one, and others did not have much cytokines released, the yellow and the blue one, but they still had celiac disease. And the people without celiac disease did not have cytokine release when they were exposed to gluten. So we believe that these cytokines have an impact on the motility of the GI tract by irritating the nerves. So it can cause nausea, vomiting, diarrhea, or constipation for other people. It may irritate the nerves that are involved with sensation. So people have abdominal pain. And it can also lead to, in the blood, to inflammation in other part of the body outside of the GI tract, causing like fatigue, headache, brain fog, joint pain, etc. We also believe that serotonin is involved, but studies are very preliminary on that topic. So this is just to give you an example that following a gluten challenge, like following eating gluten for research, several cytokines were increased in the blood with the time and the quantity correlates with the symptom severity. So red means people who had like severe symptoms. So they had like higher levels of cytokines, and gray and yellow had mild symptoms and they had lesser amount of cytokines in their blood. And one of the cytokines that seems very specific to celiac disease is IL-2, which is not released among people without celiac disease eating gluten. So the elevation of IL-2 correlated with symptoms, especially vomiting. And this is a test that is being developed currently for celiac disease. There's still lots to learn about that topic. Like I mentioned before, we do not know exactly what is happening in the body during a gluten exposure, like minutes after minutes. We do not know why some people are more sensitive, releasing more cytokines, and others do not have many symptoms when they are exposed to gluten. And we don't understand well, like, why are there extraintestinal symptoms. One question that is often asked in clinic is whether having a gluten exposure will set people back to the way they were at the diagnosis, like will it kind of like leads to major inflammation of the small intestine and lose all the efforts that were done until then. So if you still had villus atrophy at the time of the gluten exposure, it could delay the resolution of the inflammation. What I'm telling my patient often is that the only way to heal with celiac disease is to avoid gluten. We do not have like a medication that will accelerate the regrowth of your small bowel. So the only way to allow your body to heal is to remove what is causing the inflammation. And there are several studies that show that if you still have inflammation, if you still have villus atrophy in your small bowel, no, I'm going back to what I wanted to say. There are several studies that show that people who were still having inflammation, still having villus atrophy in their small bowel, had in fact gluten in their urine or their stool. So they were having some exposures to gluten in possibly small amounts that were contributing to the persisting villus atrophy. So when you still have villus atrophy, to be as strict as possible is the way to heal your body. Looking at the effect of having a 2-week gluten challenge for research, we had some volunteers in a study that was done with MassGeneral and Beth Israel, some volunteers with celiac disease who were in remission, who had like grow back their intestine, normal blood work for their celiac disease. They took either 3 or 10 grams of gluten, which is roughly 1.5 to 4 slices of bread daily. We can see that both groups had an increase in the cytokine IL-2, so their body reacted to gluten quickly, and they had some symptoms. But the group who was initially treated and took 3 grams of gluten did not have a significant change in their small bowel compared to the group with the 10-gram doses. This doesn't mean that it will not eventually happen. Like that study was only like taking gluten for like 2 weeks. And there are several studies that have shown that a more prolonged daily exposure will cause some damage. Like there was one study with 50 milligrams. So this is kind of like 2 croutons every day for 3 months. It led to changes in the small bowel. 2 grams of gluten daily for 6 weeks also lead to change in the small bowel. Another point that is encouraging is that in the gluten challenge study we did was that the inflammation was pretty much resolved after 4 weeks after the end of the gluten challenge, as long as the people were returning to a gluten-free diet. So yes, if someone has a significant gluten exposure and start having inflammation, if they return to a very strict gluten-free diet, their intestine will heal back. And finally, I just want to briefly touch upon how to manage a gluten exposure. So we often treat it similarly as a food poisoning or viral gastroenteritis. So either go on a light diet, avoid like heavy fatty foods until like the symptoms are getting better. We treat according to the symptoms. So if it's mostly upper GI symptoms, we can recommend antacids like Prilosec, anti-nausea medication like Zofran, Imodium for diarrhea. And we have been using a topical steroid for the intestine called budesonide when someone is having like very bad acute symptoms following an accidental gluten exposure. It helps reducing the severity and duration of the GI symptoms. It doesn't have a lot of effect on the extraintestinal manifestation like the fatigue, the joint pain. That will not work very well, but for the pain, the diarrhea, the nausea, it could be useful. This is not used to eat gluten. This hasn't been FDA approved for that indication. And it will not prevent the damaging effect of gluten of the intestine. So it helps like manage the symptoms, but it's not to be used to eat some gluten. So I hope I was able to give you like additional information on that topic, and then we can switch to the Q&A question. I just need to stop sharing my screen. All right. So we had lots of like questions that were pre-submitted and have been like submitted like live. One of them that is a common question is about like pizza places. So they ask, can someone with celiac disease have a gluten-free pizza that is cooked in a shared oven with other pizza, or would it need to be in its own dedicated like oven for the restaurants?
So usually what we recommend is that it's cooked on a separate clean tray, and that it's always cooked above any gluten-containing items, because you don't want them moving anything above, especially the flour that could kind of dust down on the pizza. But yeah, definitely on its own like separate tray, and then above any gluten-containing one. I mean, ideally, yeah, it would be great if it would be in a separate oven, but that, or in not at the same time as gluten-free food, gluten-containing foods, but this is not often realistic in the environment, the food service environment. But as long as it's on a clean tray and they're cooking it kind of above gluten-containing foods. Yeah, I don't know if anybody else has anything to add to that.
You can also request like a glove change if they're handling different ingredients too. That can also help you feel a little bit more safe.
Yeah, yeah.
And there were also a few questions about traveling, like how to manage like food on the plane, and also like how to manage taking your own food. Like if you go in areas where the language may be different, like celiac disease may not be like super known. So if Maria or Katarina have some insight.
Right. So international, when you're going on international flights, often they will provide meals and gluten-free meals. Depends on the airline. Usually you can request a gluten-free meal. I've done this successfully many times. And also when you're going abroad, research countries ahead of time. A really good tip is to look up their celiac organizations over there, celiac support groups and things like that, to see where you're going. They usually will have good tips on where to eat safely and things like that. And also the app Find Me Gluten-Free. I'm not sure if I'm allowed to mention that here, but that one can also be helpful in researching places ahead of time.
You can also, there are several websites that have little like restaurant cards, like different translations to different languages that just say like, I need to eat gluten-free, I can't have XYZ. And so those can be helpful if you don't speak the native language of that company or that country.
Yeah.
And as a physician, I've written like letters for patients sometimes to help them like pass through security with some foods if they needed to bring like food to their destination. And I did not disclose at first that I also have celiac disease. And one way to travel when I was younger was to kind of like do like places where like we have fridges and like hostels, and to identify like the grocery store very rapidly and prepare like sandwich with like peanut butter, like banana for kind of like the day, and then have a more like great restaurant meal for the dinner when it's all planned that it's going to be gluten-free. And I'm also having the note that we could have a medic alert. I'm just going up to the chat. I'm sorry for the confusion. So yeah, so it would be also useful to have like a medical like alert saying that you are supposed to eat gluten-free. So if a medical situation happened, they know a little bit more about your health conditions. And then about like the gluten with the FDA and everything, I just wanted to kind of like synthesize like one question and also ask Katarina. So someone asked, are there celiac who are sensitive to less than the FDA regulated like 20 parts per million of gluten? So I can say yes, technically there are some studies with people like having like acute reaction with 10 milligrams of gluten, and more recently with the gluten threshold study in Australia, 3 milligram of gluten has led to an increase in the IL-2 and a reactivity of the immune system. But it's I would say it's a small portion of people with celiac disease who are that sensitive. The majority, this is why the FDA and the Codex have said like 20 parts per million. So the majority are fine with the 20 parts per million. There may be some changes in the international regulation at some point, but for now, it's still like the 20 part per million. But it does happen that the immune system gets activated with less than 20 parts per million. But in the meantime, Katarina, there were lots of like questions like about like oats and the distinction between like it being labeled gluten-free, being certified gluten-free, and when do you trust it with oats? Like without mentioning any brands, can you go back on that topic a little bit?
Yeah, so that's unfortunately, yes, very confusing topic with oats. I mean, they've been testing oats, and obviously always make sure it's labeled gluten-free. And then there's the question of the different, purity protocol versus optical sorting. But they've found that the most important thing is that it's tested below 20 parts per million. I would call and ask the companies like how they're testing, and are they testing all the batches. It's also tricky sometimes to test oats just because they can have like pockets of grains within the oats batches. So it is a bit complicated. Gluten-Free Watchdog, they have that site. They have a lot of good information about oats as well. So you can check out that glutenfreewatchdog.org to get more information about oats. But the bottom line is, yeah, it should be labeled gluten-free. And then, ask your healthcare provider about different, if there is a specific oats that they're recommending.
Thank you. And Maria, there was an interesting question in the pre-submitted questions about like the emotional impact on the person who cares for the person with celiac disease when they are suffering through a gluten exposure. So with your practice and your personal experience, what are your thoughts about the caregiver like experience in that situation, living with someone with celiac disease?
Oh, absolutely. And I would say definitely from personal experience and observing others living with celiac disease. I mean, caregiver burnout is real, and also kind of that hypervigilance. So all these facts that I shared today apply both to someone living with celiac disease and helping someone with celiac disease. I think it's having those more tools across your toolbox can help spread that responsibility across people. Of course, taking time for personal health is always a great thing to do, and have that communication between the two of you. If you're saying, maybe I'm a little bit burned out today, and having that conversations with each other is going to be helpful in relationships.
Yes. And we know that it has a huge impact also on like the dating practice. Like some people are not like disclosing that they have celiac disease. They even like have gluten on their date because they don't want to look abnormal, etc. And one person in the comments even mentioned like how can I not look like a leper at the restaurant? So it's a huge toll on the psychological and navigating the social situation.
It definitely takes a change in perspective in your head, and that takes practice. That takes experience, lived experience of knowing that you yourself are worthy of being there, and feeling that empowerment, self-empowerment. And that takes it's a practice skill for sure.
Oh, yes, definitely. And one thing also that I thought would be good to clarify, there was a question about like soy. someone was concerned that soy was not gluten-free, but soybeans were gluten-free. So Katarina, if you
Oh,
could
yeah.
clarify the soy question.
Yeah. So this is actually, a really important one to note, because I do frequently get questions about this in clinic as well. So you don't have to avoid soy on the gluten-free diet. So soybeans are naturally gluten-free. Soy sauce is not gluten-free. And the reason for this is because soy sauce is brewed with wheat flour. Okay, so it has wheat flour as an ingredient. But soy itself is gluten-free. So soybeans are gluten-free, because I frequently get patients that avoid anything that says contains soy. So when it says contains soy, obviously look in the ingredient listing to make sure it doesn't have soy sauce that has wheat, but that should also be declared as wheat in the ingredient listing then. But soybeans, soy itself is gluten-free.
And Maria, there were some positive comments about like experience at church and social situation, and then there was a comment about like having issues with like kids with the common share buffet, that their family could have like the first pass to the buffet, but then after that everything gets contaminated. So any insights on that?
Yeah, especially that kind of buffet line situation. If it's on your own kind of family event, I've also used that technique of, everybody knows, the kids, the cousins who have celiac disease, they get to go first, and they get their gluten-free food and the things that they want, fill up their plate, and then everybody else can go through. Sometimes it can feel a little silly sometimes to have the spotlight on you. So that's another reason why it's good to have a friend or a partner in the room that can help make you feel empowered, like it's okay, you can go first.
No, absolutely. And just going back to the overall questions. So yes, Katarina, you answer for someone about like the grains, like that rice is naturally gluten-free, that other grains should be labeled gluten-free. And there were also like lots of pre-submitted question about like the labels, like can we trust something that looks okay according to the label but is not like there's no mention of like gluten-free?
All right, so first, let me address the rice. So rice has a very low incidence of like risk of cross-contamination or cross-contact with gluten-containing grains. So rice, you don't have to make sure it's labeled gluten-free. However, all other grains and naturally gluten-free grains and flours, make sure those are labeled gluten-free, because they tend to have a higher risk of cross-contact with gluten. And then, sorry, what was the next question?
Well, in general, like foods like cheese, like cheese or food that looks like according to the ingredients, like okay, gluten-free, can we trust it even though it's not like labeled gluten-free?
Even though it's not labeled gluten-free, yes. So with things like you've said, cheese and things like that, yes. Look at the ingredients always, but it's like the grains, those you should make sure are labeled gluten-free. Anything else, you're just looking for the ingredients. And there are instances where things are mislabeled, but it is pretty rare. So you should be able to trust, what they put on the label itself. And it's the most updated information is what's on the actual label. So when you're looking on websites and things like that, sometimes they may not be as updated on. So look on what it actually says on the food, or you can also contact the manufacturer directly and always ask them about ingredients as well if you are concerned.
Yes. And I got one, I'm just going to answer one last question and then I will close. What do you recommend for a celiac patient who accidentally got gluten but have no GI symptoms? Well, I would say like do not take this for granted that you can have like more gluten exposures. As I mentioned before, like the cumulative effect of gluten would cause like damages with the intestine. It's mostly like to keep having regular follow-ups with your PCP, with your gastroenterologist. We'll check for your antibodies to see like, is it like getting, do you have an elevation of your TTG that would suspect that you're getting like more exposed than you think? And also we repeat the biopsies every 2 to 3 years to confirm that the intestine has, not every 2 to 3 years, 2 to 3 years after the diagnosis to confirm that the small bowel is back to normal. And in some people with like no symptoms, sometimes we have that same regimen of doing repeat biopsies every 3 to 5 years to confirm that it's still like all normal, no recurrence of the celiac disease. But yes, so I would close the Q&A session now, and I think it's Chris who would come back.
That's correct. Well, thank you, Dr. Therrien, and thank you to all of our presenters and attendees for your participation. We hope that all in attendance found this webinar educational and helpful. Please note, if you have registered for continuing education units by filling out the survey that was presented to you in the chat box, these units can take up to 45 days to be received. Also, please remember that the recording of this and all past webinars and the All Things Celiac series can be found at nationalceliac.org. We encourage you to keep an eye on the Harvard Medical School and National Celiac Association websites and social media accounts for updates and additional information about the timing of future All Things Celiac webinars. So on behalf of all of our esteemed guests and from all of us here, we look forward to seeing you next time, and thank you for your continued support.